We are here today for a new episode of Medical Minutes. It's a meeting that we have all Saturday, sponsored by the American Academy of Thermology. This is an academic meeting. It's not a specific training, but we most of the times we bring speakers with high experience and a specific topic in specific area. And the aim here is to sharing acknowledgement from people everywhere in the world. And we had many speakers invited that take part of this meeting from other countries, from Poland, from England, from Brazil, from the US, from Mexico. So here's an international meeting in English that we have on all Saturday. And all these episodes are recorded on our YouTube channel, American Academy of Thermology channel. And also we have a podcast in what your doctor don't knows yet about thermology. It's a podcast in Spotify, and you can listen many different episodes of this amazing technology, infrared imaging. And today our special guest, he has so much experience in a product that is very interesting to us, especially because on the last episodes, we talk so much about early detection of diseases, especially diabetes, food problems, but what we can do when we find a problem on the food, and what kind of approach we can do on this patient that have a positive findings, but not really develop the disease or feel the disease yet. So we are beginning a new area of approach, and today I invited Mike Maunu from Scottsdale, Arizona, to present a very interesting product that you will love, you understand, and that we can use to monitor, to treat this patient and monitor them with infrared image. So welcome, Mike Maunu. Thank you to be with us today. I'm recording this meeting, and if you permit, we will put this on the YouTube channel. Thank you so much, Mike. Mike is a friend of mine and has a big experience, and he will tell you his history and how he started his company and his product and the things. Thanks so much, Mike. Welcome. And you have 15, 20 minutes, and after everybody here can please send your questions to Ian, open your microphone, and so it will be very interesting that we do a discussion after this presentation. Thank you, Mike. Welcome.
Thanks, Marcos. You need to unlock this share screen.
Oh, sorry. I'm doing now. It's okay.
I forgot to check. Okay. Let's see here. Okay, you can see now?
Yes.
Okay, perfect. Let me see if I can get my cursor down here. Okay, so welcome. I really appreciate the time being on here that you've given me, Marcos. It's been a pleasure over the past year. So for some of you who don't know who I am, my name is Mike Maunu. I'm the president and founder and CEO of Oxygen for Life. We're a med tech life science company here in Scottsdale, Arizona. I've been on this journey for almost 25 years now, and you'll learn more about it here. For those of you that have been in AAT for a while, at least a year, you went to the last meeting that we had in New Orleans, Louisiana, in conjunction with the huge cardiovascular conference and all the surgeons there. I was a speaker at that event. I think I was the second to the last person to go. And I spoke about our infrared thermal imaging equipment, the ThermoLens, that you can see pictured here on the left-hand side of your screen. And it was at that meeting that I first got to meet Dr. Marcos Brioski, who was the incoming chairman of AAT. And over the past almost year now, we've become very good friends, a great working relationship. And I was very honored that he allowed me to present here this morning. So without further ado, we'll go ahead and get into the presentation. And I'll go through this and try and get through it so you understand it. And then, like Marco said at the end, I'm happy to take questions, and I'll give you my contact information if you'd like to know more about it. So Anyway, so the products we're going to talk about are on the right-hand side are Brivanta, our patented medical food here in the United States, only available through licensed MDs, and then our over-the-counter product, the PEOs, that have been on the market for almost 30 years now. So the management of diabetes-related diseases and disorders, Brivanta is a new medical food actually since 2021 for treating systemic inflammation and complications of diabetes and other diseases. Brivanta is a medical food for treating systemic inflammation. It's been 25 years in development, almost 30 now. It's an ingestible blend of plant-based oils, lipids. It's used to, we're not supposed to say the word treat in the United States because the FDA says we're making a drug claim, but basically it's used to treat acute, chronic, and prophylactic use for diabetic foot ulcer healing, neuropathy, macrovascular and microvascular related issues, cellular oxygenation, and decreased infection, and much more. Medical foods treat specific diseases and disorders, and this is the definition of what a medical food is for the FDA. It's a special carve-out that was done. So you have supplements down here on the bottom, which you're not allowed to make claims about. You have pharmaceutical drugs that, we know all about them, and they cost millions of dollars to get. And then right below that is this carve-out called the Orphan Drug Act, that if there's the preponderance of evidence in the marketplace and in the scientific literature that your product can solve one of these management of what the body needs and it can't get through a normal a normal dietary intake on a daily basis, it can qualify as a medical food. And then you can make these claims for the diseases that are out there. But again, it's only available through the recommendation of a licensed MD in the United States. It's available for anyone to use outside of the United States. Okay, so let me make that perfectly clear. If you're in another country, you don't have to be an MD to recommend it to your patients. If you're in the United States, it's not a prescription, it's just called a recommendation. So it doesn't go through the bureaucracy of insurance companies and all the rest of that. Diabetic foot ulcers, enormous unmet medical needs. I think we'll all agree for those of us that treat neuropathy and DFUs. There's really no treatment out there. There's no drug protocol. It's pretty much, doing your wraps and your gauze and you're, doing all that kind of stuff. 10% of Americans have diabetes. The number's increasing. 88 million adults, approximately 1 in 3 have prediabetes. More than 1.75 million have DFU-related patients. 6% of them are diabetics annually. 25% of DFUs never completely heal. We have a white paper on that. 40% reoccur within 1 year after the first ulcer healing. These are some more stats on 46% of DFU patients have microvascular complications, 65% have macular vascular complications, 56% become infected. And the staggering thing is that there's a 28% 3-year mortality rate. Once you get those DFUs, they're killers. 42% have a 50-year mortality rate. We're working with the VA. In the VA, once if you have a DFU and you have to have an amputation, the survival rate is about 3.5 years for almost 70% of the patients in the VA that have an amputation caused by a diabetic foot ulcer. It's staggering. More soldiers and veterans have died from lower limb amputations than all the wars since World War I combined. Okay. 95% of all diabetic patients suffer nerve damage. Again, we have white papers. 20 to 30% of diabetic adults suffer autonomic neuropathy, including instability of the cardiac rhythm, blood pressure, loss of normal control of gastrointestinal tract, impacted control of the bladder, and what do you call it? Not impotence, but I can't read it. Yeah, impotence. So it's very staggering. So when someone has the diabetic neuropathy or they've developed into a diabetic foot ulcer, they have way more problems that most physicians aren't even looking at because it's not their area of expertise. But all of us that are using infrared imaging, you can see that. We can see all of the damage that's being done in the entire body when we're looking at the feet or the lower limbs or where it's at. So a lot of damage, a lot of need out there. So we started our company almost 30 years ago. Our patent owner did with these plant-based seed oils. They're fully functional. They must come from food. We have parental omega-6 called linoleic acid and parental omega-3 alpha linoleic acid. The problems are the bad rep that the omega-6 oils get is the fact that they're normally highly processed or adulterated. They're poisons that we consume into our bodies on a daily basis. All the processed foods are made with the cooking oils that have been adulterated in order to extend the shelf life of the food, but we take those in and they're literally poisonous from the inside. Parent omega-3s are rarely processed and patients consume insufficient amounts. And generally, the ones they do intake are DHA and DPA, which are derivatives of the parent form. So when we talk about a parent form, we're talking about the top of the food chain. They're taken in and then they're processed through the body, through the delta 6, delta 5 pathway, and then they're converted into the enzymes that are needed to fight the chronic inflammation and the other diseases in the body. It's important because of this. There's over 100 trillion cells, depending on who you listen to. Each cell's lipid portion contains 25 to 33% of these essential EFA. So you have a bilipid membrane, half is protein, the other is lipids. The mitochondrion, where cellular energy is produced, thousands and hundreds and thousands of them are each individual cell. So we have to have a lot of functional linoleic acid or parent omega-6. We don't get it anymore. In 2017, it was published that secretory cells are hypersensitive to changes of their membrane lipids induced by the diet on a daily basis. Diabetic patients consume processed foods, causing daily chronic inflammation. We that are using infrared imaging, we can see that. We can see that in the machine. We can see that and track that. And that's what really attracted me to get into the infrared imaging space 2 years ago and acquire the exclusive rights to the technology for our thermal lens, because we could track the pathway of the patients doctors are treating when they come in and they're diagnosed and they're put on these lipids, whether the over-the-counter PEOs or through a medical practitioner, the Brivanta. So patients' harmful processed food consumption must be compensated for on a daily basis. So the PEOs are called parent essential oils we talked about. They're plant-based lipids designed to enhance the healing of wounds and help DFUs. You'll see some clinical results here in a minute. They help improve blood flow. They increase oxygenation, not only in the bloodstream, but into the cell membranes, into the mitochondria. That's the key. Warburg proved this in 1917, or I think it was 1917 or 1927, when he won his first Nobel Prize in medicine. He's regarded as the world's most advanced and number one cellular biologist, that it was the lack of oxygen at the cellular level. It was that decreased oxygen respiration capability when he won his first Nobel Prize. They support cellular regeneration. So when you have cells that are dying every day and being rebuilt, what are the building blocks you're using to rebuild those cells? Are you using processed poison oils from the food we consume every day and every meal? Or are you using unadulterated, limited processing oils that allow your body to function correctly at the highest level? They improve wound healing outcomes regardless of underlying etiology. And these were patented in 2010 for chronic inflammation, or excuse me, cancer, chronic inflammation, and then heart disease. So this is what they are. They come in two forms. They come in a capsule form. For those people that can't take a capsule, they come in a liquid form for infants, children, geriatrics, or if you have a religious difference with taking a bovine capsule, then you would take the liquid form. We also label the liquids for veterinarians. So we have veterinarians that use this because they have the same biological makeup as humans do. Okay. And we see the number of animals now that are getting all the cancers and all the diseases that humans do. Why? They're fed food from a bag. So they're eating the same garbage that we're feeding ourselves every day. So these are the other areas that PEOs help support, because these areas are where your 100 trillion cells are. Okay. So you have to have this to make up everything. So clinical evidence for PEOs is a major university study in the state of Florida. One of our doctors knew the researcher there. It was a hyperbaric wound center. They had patients that weren't healing, that were looking at having amputations, and he says, you need to try these PEOs. And so in this 16-week study, eight of the 14 patients experienced complete healing. Surface area decreased by at least 33% in 13 out of 14 patients. Volume decreased by at least 33% in 13 out of 14 patients. It was statistically significant improvement per Alex Kiss, PhD, biostatistician for the NIH and the CDC. So we hired the best to do all the analysis here. Diabetic patients experienced a 63% decrease in wound surface area and a 77% decrease in wound volume within that 16-week period. They did go on to actually heal the rest of that, but it was only a 16-week trial. Additional evidence, PEOs were effective in healing both small and large wounds. There was no statistical difference. So it wasn't like, oh, the big wounds, they healed a lot, so it threw the numbers off, and the little wounds only healed a little bit. Nope. Also, decreasing blood glucose levels by 15 points in diabetic patients. And if you treat diabetic patients, that's huge. That's a huge number by just adding a product that you take daily without changing your diet. Imagine what would happen if you limited the amount of carbs you consume and processed oils, what that would do for a diabetic patient. So it improved the outcomes in surgical healing, faster healing, less inflammation, reduced scarring, and less pain. And it was effective even in the very high-risk patients, the diabetics, the smokers, and the corticosteroid users, where they just block and impede with drugs. So this was a lady, by coincidence, 86-year-old patient, no breaks, fracture, concussion, no pain meds required after hospital discharge. She happened to be on the PEOs for approximately a year, and she was walking in the snow in Boston, and her high heel caught in a steel grate, and she tripped and did a face plant. And so here's what this doctor wrote. This 86-year-old patient experienced a significant bilateral, orbital, frontal, and nasal crushing injury in a fall. She incurred the anticipated bilateral upper and midfacial swelling and ecchymosis, but surprisingly had much less nasal injury than expected, including no fractures, comminuted nasal bones, or orbital rim fracture, floor fracture. You would think a lady that old would fracture something. That's something older people have to worry about when they fall, right? Their hips usually go because their bones are so brittle. Within 10 days, she demonstrated remarkable resolution of the facial edema and bruising, and quickly thereafter eliminated the remainder over the ensuing weeks. So not only did it seem that her facial soft tissue and bones were more resilient and the bones also not brittle, but her overall recovery was unusually expedited and uncomplicated. What makes this testimonial so powerful, it comes from Dr. Jeffrey Robb, MD, professor, past chairman for almost 5 years, but he worked at the board there for 10 years at the Department of Plastic Surgery for MD Anderson Cancer Institute, not only the largest cancer institute in the world, but the #1 reconstructive surgery center. He's the chief medical officer for my patent owners. He retired from this board. And his past record in working with the U.S. Navy, I think he's been published 300 or 400 times. He's got a hospital wing named after him in not only China, but also in the United States. Very prominent guy. He's been working with this product for almost 15 years now. First the PEOs, and she was on the PEOs, and then the Brivanta. Here's another one using a 64 slice CT verified calcium score. Robert Kagan, former chairman of the Board of Nuclear Medicine, former head of the committee of the College of American Pathologists, past president of the Florida Association of Nuclear Medicine. I previously wrote you about the remarkable cause-effect relationship in reversing plaque volume in a smoker patient taking conventional treatment, statins, aspirin, CoQ10, etc. In reading over the patient's scans, I have never seen such a remarkable result. When he stopped taking the plant-based oils, which are the PEOs, the plaque came back. As you can see from the enclosed scan, blah, blah, blah. The volume of plaque decreased from 39 to 30, which is a decrease of 22% when annualized on a yearly basis. I have never seen a decrease of coronary arterial plaque volume by more than 5% in 1 year. You can Google this guy. Been doing this stuff for almost 40 years now. Amazing. Here's another one, 2015. He's the founder of a chronic pain management clinic in Canada, became the largest provider of pain management in Canada in 2005 to the present. Literally got all his patients off of opioids for chronic migraines with the PEOs. I prescribed the plant-based formulation to a patient with severe type 1 diabetes with all the vascular complications. He underwent a pancreatic and kidney transplant, has diabetic neuropathy, and had a non-healing ulcer on his right foot. After 5 weeks on the formulation, precursor to Brivanta, which are the PEOs, he texted me, there is a difference. I have less pain, walking better, and my foot is healing. And we have hundreds of others of these from medical practitioners as well. So pre-Vivanta, the PEOs, remission, not healing. The underlying etiology is not addressed. So we've fixed the problem. We've fixed the result, but not the problem. Brivanta is applicable to all treatment modalities as an adjuvant with no contraindication. So whatever treatment protocols you have them on, it's perfectly safe. They're just plant-based oils. It's well documented that diabetic patients have an impaired delta-6 desaturase metabolic pathway from impaired insulin production. In particular, this metabolic defect causes a poor anti-inflammatory response in type 1 patients. Even with insulin therapy, the D6 pathway is still deficient in diabetic patients. It doesn't come back. Type 2 patients also have significantly impaired of the D6D pathway activity. The deficiency in delta-6 desaturase functionality directly decreased PGE1 output. PGE1 is both a powerful inflammatory and vasodilator to keep the blood flowing, to keep the cardiovascular system from causing complications and having problems. Diabetic patients may possess only 42% of PGE1's binding functionality, which means it's a 50% decrease compared with normal non-diabetic patients. And all this is available in a white paper. And as you can see, there's all the clinical citations down below to back this up. So introducing Brivanta, it effectively manages an impaired delta-6 desaturase metabolic pathway that leads to chronic inflammation. So here's how it works. Oh, I put a wrong slide in. That's our old name. It uniquely treats the diabetic. Here's the LA and the ALA, which we were talking about, linoleic acid and alpha-linolenic acid. It helps to create new skin and underlying tissue, maximum cellular oxygenation, maximum mitochondrial function, maximum energy for cellular healing and growth. The body cannot begin to heal until we eliminate the inflammation. That is a medical facts, textbook of medical physiology, my friend. The GLA, the gamma linoleic acid, helps with the EPA and the DHA and increases those PGE1 and PGI2s, which increases the blood flow to the tissue, which allows the healing agents to get to where the inflammation is, to get to where the DFUs are. It's an anti-inflammation, anticoagulant, and anti-adhesion. So this has been published a couple times. Lipids are the #1 modifiable variable in tissue composition with potential to impact healing. Okay. So this is the eicosanoids optimization. This is the metabolic pathway in which all of this is converted into the necessary enzymes, PGE1, PGI2. And this, again, comes directly from the textbook of medical physiology. So this is how it works. These are the metabolic pathways required for optimal neuropathic and DFU improvement. We need to support nerve structure. We need an anti-inflammatory. We need to increase oxygen and decrease hypoxia. We need mitochondrial support, better nerve conduction, underlying tissue support, correct the insulin sensitivity ratio, and increase the blood flow and arterial support. So these are the different things that work to do that within our products and within the bodies going through these designated pathways. So Brivanta optimizes healing from surgeries, including vascular and CLTI. Again, white papers are available on that. Underlying tissue structural support, epithelia integrity, PAD and CBD functionality, cellular tissue oxygenation, energy, which is so important, mitochondrial cardiolipin improvement, neuropathic functionality, and insulin sensitivity. So here's a couple of, these come directly from various podiatrists that are using the Brivanta when we first released it as an adjuvant for what they were currently doing. This patient here with a chronic DFU healed in 46 weeks versus the previous 54 weeks, which was a 15% improvement, and also improved neuropathy symptoms with Brivanta use. And obviously over continued time, that will get much better. There'll be less frequency of reoccurrences as well, and increase, the rest of the body is going to function much better as well. There's a 57-year-old pressure ulcer patient, ischemic eschar I'm not a doctor, so sometimes I say the words wrong. Ischemic eschar of the second right digit. So his toe, you can seal it. He was going to lose it. Healing time was 9 weeks, and he was taking the Brivanta with enhanced healing. Here's another one, a 78-year-old venous ulcer patient. He healed 3 weeks earlier than usual, which was a 19% improvement, less pain reported also. So again, the reduction time, and this was a repeat offender, I'm just going to call it, because they haven't fixed the problem the first time around. They healed it, but they didn't fix the underlying problem. Okay. Now we can get on to better healing. So if you can do this to conditions where you already have it, that's the advantage of the thermal lens or the infrared imaging, depending on what equipment you're using, is that you can detect the hot spots before they become hot spots, before they become the ulcers already. That's something that we're working into at the VA and the Department of Defense with, is being able to recognize not only the existing ones that are physically visible because they don't have access to infrared imaging, but now they can use infrared imaging. And when they see they have this condition, they can immediately put them on either the PEOs or the Brivanta and then bring them back in 30, 60, 90 days and track the progression of the healing within the patient. It's so critical. Having an infrared machine and not having anything to give them to help them is like lunacy. We need something other than drugs because we know the drugs don't work and they cause more complications later down the road. And especially with DFUs and diabetic neuropathy, there's really nothing out there. So there's less biofilms or infections, much better outcomes. The increased oxygenation obviously kills the biofilm base and other bacteria. Suppression of infection by moderate hypoxia increases cellular oxygenation is comparable with that reported by Burke after timely adequate doses type-specific antibiotics. So it works as good or better. Fibrin, blood clots, is dissolved with the parental omega-3, parental omega-6 metabolites, also aid in the process of dissolving the fibrin. That's the key here. And the difference between the PEOs and the Brivanta is the ratio of the oils within them, because when you've been diagnosed with an inflammatory condition, we need to immediately compensate for that impaired pathway to immediately jumpstart the inflammation healing so that the metabolites, the parental omega-6 and the parental omega-3 that make up the majority of the products can then begin to do their work. So Brivanta optimizes, it increases cellular oxygenation and decreases hypoxia, prevents infection. Fat cells actively migrate to the wound to drive repair. Most doctors don't even know that fat cells go there to help with the healing process. Many bacteria die in high oxygen environments, and the supply of oxygen through micro circulation vital to resistance to additional infections. So it helps prevent further infections when you have exposed wounds. So Brivanta also helps minimize cravings for the carbohydrates. It satisfies the brain. It's systemic inflammation and patient pain. Again, we have a white paper on that, expensively done. So what other diseases, disorders, and impairments does Brivanta manage? All of these diseases on the screen right here are tied to an impaired delta-6 desaturase pathway. So if you're helping one, you're helping them all, okay? And those are all the big ones. Those are all the big ones, okay? All caused by chronic inflammatory conditions within the human body. And most patients don't know they have any of them until they have the heart attack, till they have the stroke. Dermatological conditions on the skin. The skin's all parental omega-6. And if you're incorporating processed poison into all your skin, what do you think is going to happen? You're going to be subject to infection, eczema, psoriasis, all kinds of problems. And number one out there, especially for women, is a lack of vitamin D production. You can't produce vitamin D through the skin, through the sun, if the cell membranes have been impaired with the poison that we consume on a daily basis from the food. Simple. Oops, going backwards. So critical Brivanta patient compliance facts. Loading time is usually 2 to 3 months, depending on the control of the diet and the A1C levels, comorbidities, complicating indications. So if the patient is going to continue to eat a lot of garbage, you may need to compensate with more of the Brivanta or the PEOs to compensate that. If you can get that patient to try to eliminate, which he will, the carbs and the processed food, the product's going to work that much quicker and faster. The residual benefit of Brivanta and the PEOs is limited. Daily patient compliance is critical, in particular during the loading phase. You have to get this in the body. You have to start getting that oil replaced or the cell membranes replaced. Why? Most people that are affected with the diabetic neuropathy and the DFUs are generally the older population, even though we're seeing it happen in younger and younger people. My 9-year-old niece got diagnosed with type 1 diabetes. That used to be adult onset diabetes because of the diets we're consuming. Once the loading stage is achieved, with daily use, its benefits will be ongoing. Time to reoccurrence should be significantly extended. Reoccurrence should be less severe. Optimal healing occurs if recurrence. And eventually, over time, hopefully it all stops. So again, I didn't know how long this was going to be. I had to put this together very quickly. So hopefully I didn't go too fast, but I know it's being recorded. This is my contact information. If you'd like to know more about the white papers, anything that we've done, the products themselves, feel free to reach out to me. If you're in the States, text me, email me, what have you. So with that, I'll turn it back over to you, Marcos.
Yes, I would like to present you something after. Can I?
Oh,
I have a gift here for you.
okay. You have a gift that keeps giving, don't you, my friend? Let me
Yeah.
stop the chair. Okay, go ahead. I'm going to be exposed.
No. Before the questions,
I know.
you send me some images, and as you can see, Mike is a strong guy, and he likes to do gym, lift weight, and Mike.
1, 2, 3. Where's the video?
Yeah, you show this.
The video's not playing.
It's not playing,
No,
not appearing.
maybe it's on a different screen.
Oh, okay, no, okay.
You are on the preview mode. Maybe you
Oh, there you go.
now. Yeah,
See,
that's okay.
Mike, remember the video you sent me? Mike sent me a video and also the of his body for me to see if he has any body because Mikey this product. Oh, more one more.
One more.
Okay, and here, are you listening?
Yes.
Yes, we are.
And Mike sent me the images of his body to be analyzed, and I became very surprised because Mike used these products for a long time, and I compared with another young, is the half his age, is someone in the same size that do similar exercise of Mike, and he had 35 years old. And you can see on the image of this boy many lesions on the shoulder, on the back, myofascial, in shoulder impingement. And Mike, you don't, you can find nothing. It's a body. We don't find inflammation like younger people. See, here's another image. So here, Mike. Here's the other guy. Sure, it's not direct comparison, but it's interesting to note because most of the time when I do image on bodybuilders like Mike, this is the most common finding that I see, and I never saw a guy like him that lifted the same weight and don't have lesions like the young ones. Here's on the shoulder, so Mike, he has made nothing on the shoulders, and you can see inflammation and impingement, supraspinatus, tendinitis, bilateral, most on the right side. And Mike has no pain using these products. And here again on the front, we see the pistal overload, overload on the right side, costochondritis on the right side. So most of people that do this kind of exercising, gym. They don't take care of their nutritional. They don't care. They believe that only taking proteins and not taking some anti-inflammatory foods like that, they think they will be safe. So also, when we measure here the brain function, especially related to stress, we don't find the difference so high as in this case 10.5 degrees Celsius between the brain and the nose. So it's a high level stress in this young man, and you can't find this on my images. And the complaint of this guy was a pain on the right side, and we can see the varices on the right side, but also increasing on iliopsoas and adductor muscles so high, and there's nothing on mine. So just to compare, and the foot is interesting that here we have a normal partner, and here you can see some difference on temperature of the fingers related small fiber neuropathy, maybe pre-diabetes or something like that. So the new generation maybe is not taking care sufficiently from their body, and I don't know if most of you have seen the same as I, but in my experience, it's very common young people with many of diseases and doing wrong supplementation, wrong food intake, or sometimes they believe they have a natural food intake, and it's not a reality. Did you like, Mike? Did you
I like it.
It's a surprise. I will send to you in the next. And I will open now for the questions here. And but before today, I will do my questions first, and I will open. So everybody prepare your questions. My questions, Mike, is about medical food. I believe many doctors, they don't have idea of what is medical food, especially here in US, and sometimes they confuse, or is the same of nutraceuticals, or is in the same category of vitamins, or not? What medical foods on this?
Yeah, it's really a horrible name for what the FDA called it back in, I think it was like 40 years ago in the early 70s. The Orphan Drug Act was created to allow companies that were creating pharmaceutical drugs that didn't have a lot of potential users. At that time, I think it was under 200,000, because they couldn't afford to make the drug and get the trials and get the approval. They couldn't sell enough of the product to make their money back. So they created this carve out called the Orphan Drug Act that allows companies that have products, and then they call it a medical food. And it sounds like it's something you eat when it's not anything that you eat. But it has to solve a dietary function in the human body that you can't get through a normal diet. Okay. It also has to be manufactured to the exact same standards and protocols as food products. So it has to be in a GMP certified laboratory. It has to meet all of these qualities. All the products have to be checked on a regular basis for all the different things. So that on our website, brivanta.com, you can see there's 4 or 5 different things that are required by the FDA in order to be qualified as an orphan drug and as a medical food. So it's basically feeding the body these healthy oils that they have to have in order to manage this impaired delta-6 desaturase pathway, which is the cause of the chronic inflammation in the human body today. And so the FDA allows this. It's only available through a licensed MD in the United States that can diagnose and prescribe. Okay. So a chiropractor can't use it. A naturopath in some states that can't diagnose and prescribe can't use it. But you can use the precursor product, the PEOs, because that's where all the data came from for 25 years before from that. So with the medical food, it falls under the Orphan Drug Act. So the claims can be made. So you have supplements down here, the normal vitamin stuff. You have the Orphan Drug Act, and then pharmaceuticals right above it. So it doesn't go through the prescription process. It's a recommendation. The doctor would register with us. We would verify that he's a doctor. We can sell directly to him. He can sell to his patients, or his patients can come directly to us and we can ship to them on a regular basis.
So
That's how that works.
Brivanta is a medical food, and PEOs are
A supplement.
Supplements. Ah, okay.
Yeah.
So Brivanta must be prescribed by a doctor.
No, recommended.
Recommended. Ah, okay. And
So
it's important to know the dose, the limiting dose, it depends of case. So it's important to doctor to know more about this.
yeah, it's really very systematic based upon the size of the patient and how many weight and everything. But all the original clinical work that we did, all the doctors were using the product. What we would do when we only had the supplement, the PEOs, you would just take 3 or 4 times the normal daily dosage to get the results that now you can get by taking less of the Brivanta medical food. And just as a point of reference here, when you're talking about this with the FDA, we went through phase 1 of IND trials for Brivanta, our patent holder did. And per the FDA's botanical guidance and correspondence, the entire blend of our product is considered as the API, which is the active pharmaceutical ingredients. Additionally, the FDA confirmed they confirmed the fact they were satisfied with the safety of the Brivanta product as is, because all of the ingredients are on their GRAS, generally regarded as safe. They're just lipids and oils we consume daily. And while we haven't done any control trials, they're not required by the FDA. They didn't require them. And the product's been on the market since 2021 with no serious adverse effects. And the dietary supplement's been on the market since 1996 with no serious side effects either. So they're just plant oils. All they can do is give you more energy, more strength, more endurance. And as you saw in my video, I'll be 66 in September. Until 2 years ago, I never went to a doctor, and I only went to get some blood work done just to validate. I take my PEOs for 20 years, and all of my levels were exactly perfect, including my testosterone was over 600. So that's pretty statistically significant.
Okay, Mike, we have many questions here, but I do one more, my last 2 questions that I like so much. And it's interesting that you talking about veterinaries. I didn't know that. It's important because we have many veterinaries here in AT Group, and you explained that it's possible to use in animals. And other thing is it's not oil fish, it's the plant. So it's very important, this difference. Many of the time we only think on omegas and oil fish, the things, and here it's totally different as you explain in your presentation. And the question is if you do you have experience using over the ulcers outside the body, or it's not to recommend this approach?
What do you mean? What
put the product over?
No, never. We heal from the inside. We heal from the inside.
No, just to take. And how is the taste of that when you take?
Well, I take the capsules because it's easier to take.
Capsules, yes.
Most people take it. It tastes like a sweet oil. One, because it's not been adulterated. We don't put a bunch. You can't put any flavorings in. There's companies out there that are selling fish oil products and they add flavoring because the stuff tastes so horrible. You want to throw it up the minute you take it. And what does that do? That just adulterates the product to begin with. So you just taking a product. It's spoiled dead fish. They grind up and they put a bunch of stuff in there to make it taste better. So
and make sure it's much better than oil fish. Yeah,
definitely. And it's been proven by the American Heart Association that people that are taking too much EPA and DHA from omega-3 and fish oils forces the cardiolipin out of the protecting of the heart, and diabetic patients have a higher level of EPA and DHA than normal consumers do. This is all published in the scientific literature. It's horrible for you. You're creating more of a problem.
And can you use mixed with your food, the salad, these things, no problem.
Exactly. Yeah. Yep.
Okay, nice. And let's go to the question. So if you want to do a question, raise your hands. And I have here seen Anderson Gonçalves. Please go ahead with your question.
Hi, Mike. How are you?
I'm good. How are you?
Good. Thanks for the outstanding presentation. These products are very impressive by what they do. And from what I understood was the Brivanta is a systemic effect, and the oils are more a local application. The Brivanta can only be recommended by an MD but how do you work with podiatrists or chiropractors or acupuncturists that do see quite often neuropathy and diabetic foot disorders? And do you recommend that they go for the oils? It's more of a topical, local application there.
No, as Marcos just asked, none of it's topical. Everything is taken internally.
Oh, okay.
Okay, a podiatrist is generally going to be an MD. He can diagnose, so he can recommend the Brivanta. And so in my presentation, the first part of it, we were talking about the wound therapy. It was actually the University of Miami, their hyperbaric wound treatment center. They use the PEOs. They use the over-the-counter product to get those results of reducing all of. They just took a higher dosage than you would normally if you didn't have a problem. Okay. And then the Brivanta eliminates the having to take the higher dosage initially to build up in the body. So they both are going to do the job the same. One's going to be quicker, and one, because of the fact that there's a higher ratio of the GLA to bypass the D6D pathway impairment to help with the inflammation and help the healing start quicker. You'll get the similar or same results using the other oils. It's the same. The ingredients are the same. It's just the ratio of the oils, and it gives us the ability to allow it to be an orphan drug and make the claims where we can't with the other one. So they're both going to give you the same result.
Nice.
Got it. Understood. Thank you.
You're welcome. Thank you for your question.
Thank you. Please, Fabio, you have an interesting question. Go ahead. You can open your microphone. Fabio Nunes. Would like to do your question here?
Oh, Marcos. Good morning.
I help you. Fabio has a question about. He put here, Mike, on the chat. Epigenar PEO black currant seed oil. This is good.
No.
This, Fabio, is this what you want to know about the Epigenar PEO? Yeah.
Yes. I researched in internet about, and I want know it's the good for health also.
Do you know, Mike, about that?
The black currant oil, is that what he's saying?
Is here on the chat. If you open the chat, it's Epigenar PEO black currant seed oil.
No, so there's no black currant seed oil in it. We use in the evening primrose, sunflower, flax, and there's one other one, safflower, I think. But it has to be in the correct ratio. It's in a ratio of 2.5 to 1, parent omega-6 to parent omega-3. It's all got to be organic, because if you get the ratio skewed, it's based upon the human body. How much oil is in this omega-6 in the skin? How much is in the brain? How much is in muscle tissue? All of that's taken into consideration and factored. It's just not something as simple as, well, we just need this, whatever. And this was perfected almost 30 years ago to get this optimal ratio of 2.5 to 1 of parent omega-6 to parent omega-3. And we have like a 50-page white paper on it. So if you email me that, we can send it to you on how these ratios come about based upon the human body. The skin's the largest organ. It's got the most parent omega-6, but yet it doesn't weigh very much. Okay. And you also have to think about this. When we think of skin, we think of only the outside skin, but yet every organ is wrapped with skin. Okay. So this is also going to help, like anybody that has gastrointestinal problems or leaky guts, because the skin that surrounds the gut is compromised from the processed oils. And so the cell membrane's not the way it's supposed to be. So the black currant oil, it's not going to do very much for you.
Yeah, this is the other question. Mike, if you could please put your email on the chat. He wants papers, reference more. He wants to know more about. And also, Sidalia, she wants to know how she can order Brivanta from Brazil. But if you're from another country, please.
Yeah,
no problem.
Yeah, no problem.
And Sidalia, go ahead with your question about the microcirculation. Thank you. Is closed, mute, you're mute.
Sorry. Okay. Hi, Mike.
Hi.
I'm more interested about microcirculation and, for example, cardiovascular effects. So my question is, if considering the microcirculation enhanced that we saw in your presentation, I wonder if in your research you found some relationship between the release and production of nitric oxide and these effects, okay, in the Brivanta, for example.
Sure. So, and I think I understand your question correctly, but basically we're talking about increased vascular circulation, getting more blood flow, the venous flow of blood, which is critical for healing. So in our first patent on our PEOs, the over-the-counter product before Brivanta, we did a 90-day study, independently reviewed. And we took, I think it was 15 patients, average age was about 60, and we used what's called a pulse wave analyzer. So it's an FDA cleared medical device. We have one here in our facility as well. It looks like a pulse ox you put on your finger, but it uses infrared and it measures the wave going to the toes and hands and comes back. And we were able to show a 10-year biological reduction in aging within the cardiovascular system, okay, in 90 days on the product, okay? Clinically significant, and it's published in the journals, and I can send that to you as well. Those that had been on fish oil prior to took an extra 30 days to get the same result because we had to get the fish oil out of the body. It was causing a compromise of it. So, and as Dr. Kagan also published, and I only talked a little bit about, but I can send you his data as well. That was the nuclear medicine guy from Florida. He took all his patients off statins because he'd never seen, because we're told by cardiologists, there's nothing that can reverse cardio plaque, okay? And we know statins don't do it, and it causes more problems. This will reduce it, and you will be able to see it if you're using infrared. You'll be able to see that increased blood flow. Marcos is working with that now. So it does work, and we have proven its work, and it's actually allowed us to get the medical claim in our first patent for reducing cardiovascular disease.
Okay, thank you. And my first question was, how can we order this product from Brazil?
Okay, I put my email in the
okay, thank you.
Or you can reach out in the WhatsApp or whatever, and reach out to me. Let me know what you want, you need. I can send you all the price. I can send you white papers. I can send you all the details on it. And any of you that get that and you're using the infrared, we're gonna love to see this. This is the reason. I mean, if I didn't have a product that worked and delivered the results, and obviously Marcos showed my videos of the condition I'm in at 66 years old, almost, no, 65. I don't want to age myself. And the condition I'm in with what I do, I would never use a machine like the infrared or this other medical device to prove our products work. I want people to put people on our product, do the infrared scans, bring them back in. And the same thing with veterinarians. We have white papers from veterinarians that have used it to treat llamas and alpacas in Canada. And the results they got by putting them on the oils are phenomenal, absolutely phenomenal, because they have the same physiology. So we're going to love to get feedback from anyone that uses the products in their practice and can report back to us.
Thank you very much.
Mike, I think we need to call you again in another presentation because many people is giving likes of your presentation. And Mishari is saying, thank you, Brioski, for bringing the most interesting speakers to this session. It's very good. And many people are asking about pictures, images for the next presentation. Go ahead, Mike. Sorry.
I'm sorry. I was just going to say, because if we run out of time, yeah, I guess we're out of time. So you guys have my email address, and maybe Marcos can put it in the WhatsApp. If you still have questions that you didn't get answered or you want more, just send them to me, and I'm happy to answer. As you can tell, I can talk about this stuff for hours and days. It's just my passion to help heal people like everybody on this call. But it's so good. There's nothing more disheartening is to tell someone they have a problem and then not really have anything to give them to help them with it. And when you have something like this, you just can't stop talking about it.
Okay, I think we have two questions here. The last one, if someone need one question, please hand your hand. But now I see here, Mandara. Do you like to do your question? Mandara, please go ahead or unmute. You're mute, please. And after Belen and someone else? No? Go, Mandara.
Hi, Mike. Thank you
Hi.
so much for that great presentation and your good work in trying to help so many people because this is a significant area that needs attention. I was wondering if you have any images, thermal images of your before and after working with the diabetic patients.
We don't. We're building that right now, and that's one of the reasons why we've been working with Dr. Brioski to help us get that put into place. And so we'll have some very shortly. The problem with me is, as you can see, I'm not the good example because I don't have any problems in which to follow along with. But we've just opened our first clinic here. I became the exclusive distributor of the ThermoLens, the machine you saw, and it comes in a portable version here in the United States. And we're selling to doctors and everything, getting the machines out there and the products. And then we're just now opening our first clinic as well here local in our office so that we can start building that for more information. But we will have some for you. And Dr. Brioski will have we'll have the access to it.
Okay.
Thank you.
The last question, Belén from Spain. Go ahead.
Yeah, thank you. Nice to hear your presentation, Mike. Thank you very much. I'm already exhausted after seeing the video Marcos Brioski shared with us. My God, I need to work a lot in order to be at your level. But I've got an interesting question for you, or I guess it could be interesting. Okay, I completely understand your philosophy about healing from the inside. But I'm deeply familiar with the use of oils in some ancient tradition, as Ayurveda or Chinese pharmacopoeia. And I was thinking that it could be a very good synergy in order to have also a topic version of your parental oils, because then you could target inflammation in a specific zone of the body. What do you think? This is the first question.
Okay, so that's a very good one. So very early on, we thought the same thing. And we did have some patients, not me personally, but other physicians with diabetic neuropathy, the wounds and everything. And we applied the oil directly to the wound itself and wrapped it. It didn't change the result of how fast it healed by just doing it from the inside as well. It's not going to hurt, okay? But because of the fact that we're trying to solve the problem, which is the impaired pathway that caused the inflammation to begin with, we can't fix that from the outside. It's within the inside of the body where the problem started. So even though you're working on the problem, we want to go to where did it start, which is that impaired pathway. So you can do both. And again, topically, if you're using anything other than a blend of what ours is, that's why people, I mean, whether you believe it or not, so much damage is caused by sunscreens because those chemicals are horrible for you. But if your skin's already compromised because you have bad oil incorporated into it, even the oil you put in topically is not going to be absorbed through the cell membrane, or you're going to get too much of it. So you can do it. And we did try it like 15 years ago, and it just didn't do that much of a difference cost-wise to make sense.
Okay, understood. I don't know if you are familiar with the ancient Ayurveda tradition, but if you are not, I will be more than happy to share with you a lot of information because it's really interesting. And I was thinking that we are kinesthetic human beings. So applying it also on a topical way, we are also focusing on the nervous system and on the emotions on the patient. So I was thinking that this is also the focus of other traditions. This is why I was questioning you that.
Yeah. Again, I can't make a definitive 100%, but more than likely, initially, you have to get the body back to homeostasis. You have to get it back to a baseline where the body's functioning correctly to allow the oils you're talking about or whatever they're supposed to be absorbed and used correctly. It's the same thing with, I used to think it was, the chronic disease was caused by a lack of oxygen. in the bloodstream. Most people think it's, oh, I get more blood, I do ozone, or I do this, or I do hyperbaric oxygen. No, it's all about getting oxygen into the cell membrane. And if the cell membranes are compromised, even on the exterior, whatever you're applying can't get in. So we need to fix the cell membranes from the inside to allow that oil to get in. Does that make sense?
Yeah, I was just thinking about using both.
Yeah, and again,
at
we
the same
tried
time.
it, and you can perfectly try it and see, does one work better than the other one? I'm not going to say it doesn't, because I don't know the oils you're talking about, but we tried it because we thought, hey, if it works on the inside, it's going to work faster by just putting it all over your body. You know what I'm saying? Like the oil man. There's a story I heard about an oil man that rides his bicycle down in Brazil. But anyway, yeah, so I'm happy, just, you have my email, so just send me whatever you have, and we can correspond back and forth. That'd be perfect.
And just a quick last question, because I think you didn't mention it. Well, yeah, you said your oils are plant-based, so they are all vegan.
They're all, yeah, absolutely. So you get it in the liquid form, they're all vegan. They're all vegan friendly.
Great to know. Thank
Okay.
you.
You're welcome. Thank you for the great questions.
Thanks.
Yes, Jan, we have extensive on cancer. Extensive. Hold on one second. Hold on, Marcos. Don't go anywhere.
Oh, it's amazing presentation today. It's very important because we are opening our mind to new, beyond the just heat image here. Oh, great.
So Jan, this is my patent owner's first book he published in 2010 called The Hidden Story of Cancer. It's literally almost 800 pages, all medically referenced, indexed. It was available. We no longer put it in print because it's too expensive. It's in all the hospitals, the universities in California. It's used all over the world. The number of doctors that go, it's the best thing they've ever seen and written on it. So we have extensive work in cancer, and that was our first patent for the PEOs, was cancer.
Nice. And there are many papers from Peskin and his group. So, but this is another episode.
Yeah.
And as I'm telling Dan, Mike, it's very interesting because we are opening our minds not beyond just thermal images. So thermal image is just a piece of the puzzles, and we need to open mind to solve the problems, and we need just options to solve the problems very early, that we find not just finding problems, but how to solve them in the best. And you today show us an interesting way to approach our patients and different kinds of disease, not only on diabetes, but any inflammatory diseases. And it's almost all 80% of all diseases are inflammatory in some aspect.
And
we need a second session with Mike. We need a medical minute second session with Mike.
Yeah.
Uh-oh, look out, Marcos. Look out.
Yes.
I'm coming for you.
Okay.
Julie's just reach out to me, and we can share the information on our infrared imaging equipment, both our portables and our full-scale hospital doctor's offices one.
Okay, so we are finishing our medical minutes, and I leave here on the chat the link to the Spotify. We have more information about this if you want to go here in this episode 22 about how to optimize this fat metabolism. There's some information about PEOs, infrared monitoring. And thank you so much for your presence here. We are increasing the number of people interested on what you're doing. So American Academy of Thermology is open for you can suggest other speakers. You can send comments. You can send if you like, if you don't like, no mind. We are here open to listen everybody. So keep in touch. If you're not a membership yet, do your membership on our website, and we will have news for these years about meetings, trainings, online trainings, face-to-face training at US. So welcome, and keep in touch with us, and take part of our WhatsApp group also. We have a WhatsApp group, and you can share your ideas with me. Thanks so much, Mikey. And it was a presentation, and see you on everybody here on the next Saturday on our medical minutes. Have a good weekend, everyone.
Thank you, everybody. Excellent.
Thank you.
Have a great meeting.
Thank you.
I'm just emailing you, okay? I'm just sending you an email.